Okay.
Hi, my name is Alexandria Scott Newsom. I'm doing the IDS 402 capstone interview with Miss Keela Fielder. How are you today?
Good. How are you?
Okay, I'm fine. I'm doing my project on the business and public policy. Basically, what do they do and how do they affect the homeless epidemic in women with children? And basically, in urban areas. So, Hattiesburg is pretty urban in certain areas. All right. And I understand that you are a health professional, correct?
That's correct.
Okay. Do you see many women with health problems coming in and out through the health facilities that could oppose or maybe raise like awareness of maybe of their home and environment?
Yes. We have. Well, I am a respiratory therapist. I work with all kinds of people: men, women, children, um, Hispanic, black, white. They all have the same problems. But as far as homeless, in some different ways, we can tell that they're homeless is how if they're malnutrition or if they're having some type of respiratory infections or diseases and things like that.
Okay, well, I understand that my project is really not on a specific group type, but the fact that it's women with children. Can you maybe give us an ethnicity with more volume that comes in and raises that question on they might be homeless?
Um, Women that are not educated, Hispanics, specifically Mexicans, that don't have the income to take care of their family and don't know what type of insurance or things that they need to have to take care of their families. We have, for instance, in an example, I had a patient to come in the emergency room. Her baby had asthma, and that's one of the hugest things that they have in homeless people because of the cigarettes causes the asthma and bronchitis. They just treated the baby and let him go because they didn't have the insurance.
Mm. And so, how does that work if you don't have insurance? How far of the care does you all care providers give to these type of people, and whether or not do you think it's like a public policy effect or more so of a business effect on this epidemic?
It's a business effect. It's all about money. If the physicians aren't getting the money that they're wanting to get, they're not going to take care of the patient how they need to be taken care of.
Could you also say a public policy because then when you express that type of terms on business, it's like, well, wouldn't healthcare deal with the Reform Acts dealing with Obamacare and Congress basically having governmental cutbacks and not agreeing on stuff within that type of stuff?
Yes.
And you said basically Mexicans. Would you say that maybe it's a immigration problem?
It is.
Okay then. That's something new within the research. I've been doing a little bit more research as it comes closer towards, my capstone end of time for the class, and I have noticed some more information, and it was quite concerning. So I kind of want to talk more into a health professional because I done so much research on business and public policy. Is there anything else that you can probably tell us that poses questions on homeless women with children that comes in with and out the health facilities?
Most of the cases it starts at birth when the infants. Well, if the mother is already homeless and is pregnant and then they have the child and they're already having problems and don't have insurance, so that's usually where it always starts is in that area. Okay. Once the mother have the child, of course they're not going to deny pregnancy, but after aftercare of the hospital stay, that's when the health goes down the drain. It usually starts with pneumonia, um, tuberculosis, let's see, bronchitis and things like that. But as far as not being educated on what the needs are for the mothers to take care of their families, that's the main focus on what that needs to be done with the homeless women.
So it's a lack of education.
It's a lack of education. It's a lack of income. I mean, of course, if they're home, it's a lack of income, but
An affordable house.
Yes.
All right. Okay. Another thing. Would you? Okay. If I understand, there's not many like homeless shelters around here, and so if there happen to be some within a particular healthcare facility or emergency room, do you all get like regular visits from them type of people actually trying to come and help their patients, or would there be like some traveling nursing going involved to help provide health care to those that are actually in shelters?
Not that I know of. Not from what I've, experienced. I have not heard of any nurses or anything going to shelters helping others unless they are at like a facility, like a
Yeah.
nursing home,
Mm.
or if it's like home health, but not shelter.
Mm.
Nothing's gonna get done for free when it comes to the healthcare profession.
So this causes more of a health problem on women with children that are homeless.
Yes.
And you'll basically say that it's more of a business problem.
It's all about the money.
It's all about. Why do you think it's all about the money?
Because
I mean, if I was a nurse or in the health profession, I probably would spend some of my time providing service to those that I could. And I don't know. It's just this is an epidemic that's on the rise, and basically, I have been reading partially through my papers that there are health problems. And would you ever say you ever came into contact with domestic violence, and maybe question on whether or not have you like seen that same patient and you wonder, are they homeless now because they're not with the same partner, or you done experienced some of their, conditions back in the past?
Yes. A lot can be done with the with domestic violence and the homeless. I have had one or two occasions that I've known that the children are homeless, but they've always had that dad or someone there with them, because if we see that the child is homeless or the mother is homeless, we're supposed to report it, to the DHS, so that we can get it further taken care of, so the child can be taken care of healthcare wise. But as far as the domestic, as far as the child, I don't say, but as far as the neglect, yes.
So, do you say you all actually take out the time to report these incidences to DHS?
Yes.
How could you say statistically about how many reports you all do a year?
That I don't know. As far as respiratory therapists, we don't do the reporting. It would be the nurses or the doctors, and they report it to the social workers, and that's how that goes. But as far as me knowing, I don't know the statistics on that.
Okay, what about respiratory wise? Can you give me a statistical number about how many cases you have seen with respiratory infections that are homeless?
I've been in the profession for 4 years. I've seen at least 5 that I know of that are homeless.
Okay then. And you said it's more of a Mexican and Hispanic thing that comes in with the children, more the women and children.
Yes.
Wow. That raises a lot of concerns on the ethnicities, because I read that a lot of white, Hispanic,
yes, whites also.
and that blacks, African Americans are becoming on the rise.
They are becoming on the rise, but mostly the Hispanics.
Okay, then. Well, I want to thank you for your time. I enjoyed our interview with you. This will be getting on YouTube so that people in the world can see how problematic this epidemic is. And I just want to thank you for taking out the time with you, Miss Fielders.
Thank you, Alex.
You're welcome.